Welcome back to our channel. Today we are going to talk about a very common blood disorder that affects millions of people around the world: anemia. Anemia occurs when your body does not produce enough red blood cells or hemoglobin, which are responsible for carrying oxygen to your tissues and organs. In this video, we will discuss the signs and symptoms of anemia, as well as some simple home remedies that can help you manage the condition. Anemia is a medical condition in which the body does not have enough healthy red blood cells or hemoglobin to carry oxygen to the tissues and organs. Hemoglobin is a protein in red blood cells that binds to oxygen and carries it throughout the body. Red blood cells are produced in the bone marrow and have a lifespan of about 120 days. When the body does not produce enough red blood cells or hemoglobin, or when these cells are destroyed faster than they can be replaced, it can lead to anemia. Anemia can be caused by various factors such as iron deficiency, vitamin B12 deficiency, folate deficiency, chronic diseases, blood loss, and genetic factors. The symptoms of anemia can vary depending on the underlying cause and severity of the condition, but common symptoms include fatigue, weakness, shortness of breath, pale skin, irregular heartbeat, headaches, brittle nails and hair, cold hands and feet, chest pain, tongue swelling, restless leg syndrome, increased heart rate, and jaundice. Treatment for anemia depends on the underlying cause and severity of the condition. It may include dietary changes, supplements, medication, or other interventions. Iron supplements are commonly prescribed for iron deficiency anemia, while vitamin B12 and folate supplements may be prescribed for deficiency anemia. Blood transfusions or bone marrow transplants may be required in severe cases. Here are some signs and symptoms to look out for which can be an indication that you might be anemic. Fatigue and weakness. If you feel tired and weak most of the time, even after getting enough sleep and rest, it could be a sign of anemia. Shortness of breath. If you feel breathless after performing simple tasks, such as climbing stairs or walking short distances, it could be a sign of anemia. Dizziness and lightheadedness. If you feel dizzy or lightheaded, especially when you stand up quickly, it could be a sign of anemia. Pale skin. If your skin appears pale or yellowish, it could be a sign of anemia. Irregular heartbeat. If you experience an irregular heartbeat or palpitations, it could be a sign of anemia. Headaches. If you have frequent headaches, especially when you are active, it could be a sign of anemia. Brittle nails and hair. People with anemia may experience brittle and weak nails and hair due to a lack of iron. Cold hands and feet. Anemia can cause poor blood circulation, leading to cold hands and feet. Chest pain. If anemia is severe, it can lead to angina or chest pain due to the lack of oxygen to the heart. Tongue swelling. In some cases, anemia can cause swelling or soreness of the tongue. Restless leg syndrome. People with anemia may experience restless leg syndrome, a condition that causes an urge to move the legs due to discomfort. Increased heart rate. Anemia can cause an increased heart rate due to the body's effort to pump more blood to compensate for the lack of oxygen. Jaundice. In some cases, anemia can lead to jaundice, a condition in which the skin and eyes turn yellow due to the accumulation of bilirubin in the body. There are some easy and simple home remedies that can be used at home to manage anemia before visiting a doctor. Iron-rich foods. Since anemia is caused by a lack of iron in the body, it is important to eat foods that are rich in this essential mineral. Some iron-rich foods include red meat, liver, poultry, fish, beans, lentils, spinach, and fortified cereals. Vitamin C. Vitamin C can help your body absorb iron more efficiently. Foods that are rich in vitamin C include citrus fruits, strawberries, kiwi, mango, papaya, pineapple, and tomatoes. Consuming vitamin C-rich foods along with iron-rich foods can help increase your iron absorption. Some examples of vitamin C-rich foods include oranges, grapefruits, lemons, kiwis, strawberries, tomatoes, broccoli, and bell peppers. Folate-rich foods. Folate is a type of B vitamin that is essential for the production of red blood cells. Some foods that are rich in folate include leafy green vegetables, asparagus, broccoli, citrus fruits, beans, peas, and fortified cereals. Beetroot. Beetroot is a rich source of iron, folate, and vitamin C, making it an ideal food for people with anemia. You can consume beetroot in the form of juice, salad, or cooked vegetable. Blackstrap molasses. Blackstrap molasses is a sweetener that is rich in iron, magnesium, and other minerals. You can add blackstrap molasses to your tea, coffee, or smoothie to boost your iron levels. Nettle tea. Nettle tea is a natural diuretic that can help increase the production of red blood cells. You can drink nettle tea once a day to manage anemia. Nettle tea is a natural diuretic that can help increase urine production and flush out excess fluids in the body. It is also rich in iron, calcium, and other minerals. Drinking nettle tea 2 to 3 times a day can help boost your iron levels. Pomegranate juice. Pomegranate juice is a rich source of iron, vitamin C, and antioxidants. Drinking a glass of pomegranate juice daily can help increase your iron levels and improve your overall health. Apple cider vinegar. Apple cider vinegar is rich in iron and other minerals. Adding a tablespoon of apple cider vinegar to a glass of water and drinking it before meals can help improve your digestion and increase your iron absorption. Beetroot. Beetroot is rich in iron, folate, and other nutrients. Consuming beetroot in salads, smoothies, or juices can help increase your iron levels. If you experience any of these symptoms, it is important to consult your healthcare provider for proper diagnosis and treatment. Your healthcare provider may perform a blood test to check your hemoglobin and iron levels, as well as other tests to determine the underlying cause of your anemia. Treatment may include dietary changes, supplements, medication, or other interventions depending on the severity and underlying cause of the anemia. Anemia can be identified by various signs and symptoms such as fatigue, weakness, shortness of breath, pale skin, irregular heartbeat, headaches, brittle nails and hair, cold hands and feet, chest pain, tongue swelling, restless leg syndrome, increased heart rate, and jaundice. If you experience any of these symptoms, it is important to seek medical attention to determine the underlying cause and receive appropriate treatment. If you have been diagnosed with anemia, it is important to eat a balanced diet that is rich in iron, vitamin C, and folate. You can also try some simple home remedies, such as beetroot, blackstrap molasses, and nettle tea, to manage the condition. If your symptoms persist or worsen, it is important to seek medical attention to rule out any underlying conditions. Thank you for watching, and don't forget to like and subscribe to more health contents like this.